Hello. In this video, I want to talk a little bit about assessment, moving beyond the initial phases where we discuss confidentiality, informed consent, structure, schedule, perhaps fees for service, ways of communicating with the client. And we've completed initial assessment, um, what a client is coming in for, what they're expecting from therapy, and a number of other initial assessments of who they are, their demographics, which populations they um, belong to, and their values. Um, we're going to move into a deeper assessment, and what I'd like to do is just trace a couple of ideas that you could be thinking about throughout the initial stage and even the intervention stage of a counseling relationship. So one of the first things I want you to think about is assessing what can't be changed. So clients come to us with a problem or a personal growth intention, and they're looking for change. That's one of the main reasons that people come to us for help. So I'd like you to start thinking about what can't be changed. And this will help formulate realistic expectations of yourself and have the client have realistic expectations of themselves. So when it comes to their temperament, medical history or medical conditions, um, histories of trauma or past experiences, um, external circumstances, um, and any other part of their personal history. They might want to change how they're coping with any of these issues. They might consider how they're receiving support or accepting support, or how they want to make meaning even of any of these features of their life. But there are plenty of features that cannot be changed. So this is one thing I'd like for you to start thinking about in terms of assessment. What cannot be changed? Another aspect of assessment is assessing development, and this doesn't just mean for young people, but it can be particularly meaningful when it comes to young people, but thinking about their development. So their genetic and epigenetic development, um, responses to stressors in their lives. Um, in assessing development, it's important that we take a history of our client to really understand anything from postnatal issues to their original attachment figures and any kind of separation history from their parents, to what degree our clients have differentiated and have their own identities, or in what ways they're still attached to their families of origins and their communities. Any history of childhood illness or accidents, and then school history. What was it like for them to be in school, their experiences of learning, their experiences of receiving help. Within development, we also can think about assessing attachment styles. So Bowlby and Ainsworth have done an enormous amount of research in the area of attachment. It's been validated over time. And so you can think about their attachment styles, which will sometimes play out in the therapeutic relationship, but also inform their current relationship. So the securely attached, the avoidant attached, the ambivalent or resistant, and the disorganized attachment styles. Understanding these attachment styles, how they've manifested throughout life, how their etiology is in early childhood experiences, and how they're informing both current relationships and the relationship with you, the therapist, in the counseling situation. You also might think about an Ericksonian perspective on development and his stages and the crises between each stage and the challenges and tasks. There's a number of developmental theories that you can draw on, and so I just wanted to flag development as one area of assessment. Um, the last piece on assessment that I'm going to touch on this video would be mental health diagnoses. And so this is a very complicated area. We have psychiatry and psychology having developed the Diagnostic and Statistics Manual, and this is a large text that contains innumerable diagnoses, disorders that are categorized according to um, a checklist or a algorithmic type um, assessment tool where you would assess a client's symptom profile, so the signs and symptoms, what they're displaying and what they are bringing forth in terms of their experience, how they're talking about their experience. And psychiatrists and psychologists would use the Diagnostic and Statistics Manual to formulate a diagnosis or a diagnostic impression of your client. And these kind of diagnoses carry significant medical weight and can also be tied to treatment, especially medication interventions. Um, However, from a more critical perspective, we can understand that all people's experiences lie on a spectrum, and that there's no particular ontological categories or particular kinds of people in the world, that we all, to a certain degree, experience a range of signs, symptoms throughout our lives, and that the approach of trying to fit people into these categories is highly problematic in some ways, and we can go into the challenges and benefits of a psychiatric model of assessment throughout our work together. I just wanted to initially flag that right now so that you can understand that these assessments are they're extremely powerful in the lives of the people we work with, and the power to make those diagnoses lay in the hands of particular people within society, and orienting yourself to the assessment tools and the diagnostic procedures of others, how to communicate and understand that language, and at the same time be critical of it, while providing a client with the space to make meaning of particular assessments, particular psychiatric assessments, in the context of a helping relationship. Again, we can develop into all of these a little further as we work together. I wanted to lay out a couple new ideas about assessment as you move forward. Thank you.